Hello everyone, I'm Anas Al Ubaidi, and the topic for this session or this lecture is GI symptoms assessment and renal function documentation within chapter 30 of Review of Gastroenterology and Nephrology Scribing within the Certified Medical Administrative Assistant Course Program by ACMSO. Introduction. In the realm of medical documentation, the accurate assessment of gastrointestinal GI symptoms and renal function is paramount. These two areas are critical in diagnosing and managing a wide array of medical conditions. For medical scribes, understanding the nuances of these assessments is essential to ensure precise and comprehensive documentation, which in turn supports effective patient care and communication among healthcare providers. Gastrointestinal GI symptoms can range from common issues like nausea and vomiting to more complex conditions such as Crohn's disease, CD, and irritable bowel syndrome, IBS. Each symptom can provide vital clues about a patient's overall health and potential underlying conditions. Therefore, a thorough understanding of how to assess and document these symptoms is crucial. Similarly, renal function documentation is a cornerstone of patient assessment, particularly in patients with chronic conditions such as diabetes and hypertension. The kidneys play a vital role in maintaining homeostasis, and any impairment can have significant systemic effects. Accurate documentation of renal function tests or kidney function tests, such as glomerular filtration rate, GFR for short, and creatinine levels, is essential for monitoring disease progression and guiding treatment decisions. The key points here. Now, the key points will start with the gastrointestinal or GI symptoms assessment. Symptom identification and documentation, understanding the broad spectrum of gastrointestinal GI symptoms is a foundational skill for medical scribes. The accurate identification and documentation of symptoms such as abdominal pain, bloating, diarrhea, constipation, nausea, and heartburn are essential. This process requires capturing precise details of each symptom structured around these key elements: the onset, location, duration, and aggravating/alleviating factors. Onset: when did the symptom begin? Location: where is the discomfort located? Duration, for example, how long does the symptom last, and is it constant or intermittent? We have the aggravating/alleviating factors. What makes symptoms worse or better? Thorough patient history. Now, documenting a comprehensive patient history provides valuable context for understanding GI symptoms or gastrointestinal symptoms. Focus areas include dietary habits, medication use, family history, lifestyle factors and stress levels, surgical history. Dietary habits: what does the patient typically eat? Are there specific foods linked to their discomfort? Medication use: certain medications like nonsteroidal anti-inflammatory drugs or NSAIDs or antibiotics can induce GI symptoms. Family history: a patient's genetic predisposition to conditions, for instance, like CD, which is short for Crohn's disease or colon cancer, is invaluable, of course. Lifestyle factors and stress levels: GI symptoms often correlate with stress and sedentary lifestyles or lack of sleep. Surgical history: any prior or in the history, any gastrointestinal GI surgeries or illnesses influence symptom presentation. And here's a diagram on analyzing causes of GI symptoms. Physical exam or physical examination findings: documenting observations made during a physical exam is equally important, as key signs and their relevance include abdominal inspection. Look for distension, visible masses, or scars suggesting prior surgeries. Palpation findings: tenderness in specific quadrants. For example, rebound tenderness in the lower right quadrant indicating possible appendicitis. Auscultation: note any hyperactive or hypoactive bowel sounds that could suggest obstruction or ileus. Systemic signs: document additional findings such as jaundice, yellowing of the skin, which may indicate liver dysfunction impacting the GI symptom. And here is a summarized diagram summarizing the key signs in physical examination or physical exam. Diagnostic tests and procedures. Scribes play a key role in preparing and documenting the results of diagnostic tests. Common procedures and their documentation include endoscopy/colonoscopy. These procedures visualize the GI tract and support diagnoses such as peptic ulcers or colonic polyps. Documentation should include preparation compliance findings, for example, gastric erosion detected, and recommendations for follow-up actions. Stool analysis testing for pathogens or occult blood can identify GI infections, gastrointestinal infections, or malignancies. Proper recording of test results and any advised treatments such as antibiotics is essential. Imaging, ultrasound, CT scans, or MRIs are critical when non-invasive visualization of GI structures is needed. For example, an ultrasound detecting gallstones should not size and number to aid in surgical decision making. Recognizing red flags. An essential part of GI documentation, gastrointestinal documentation, is recognizing urgent signs or symptoms requiring immediate interventions. For example, examples here: severe acute abdominal pain, rectal bleeding or melena, black tarry stools, prolonged vomiting leading to dehydration, unintentional weight loss, which can signal malignancy. By ensuring these details are captured, scribes enhance clinical efficiency and quality of communication between providers. Renal function documentation. We have here the importance of renal assessment. The kidneys contribute to crucial bodily processes, including filtration, waste excretion, and fluid balance. Understanding their function allows scribes to document findings in chronic conditions like hypertension, diabetes, and chronic kidney disease (CKD). Here's why proper renal function documentation matters: early detection, monitoring disease progression, and tailoring treatment. These are the reasons why proper renal function or kidney function documentation matters. Key renal function tests or kidney function tests. Medical scribes must understand the purpose and interpretation of renal lab or laboratory results to document them accurately. Serum creatinine indicates how well kidneys are filtering waste. Elevated levels suggest decreased kidney function. Blood urea nitrogen, BUN or BUN, reflects protein metabolism waste clearance, with high levels often seen in dehydration or renal or kidney dysfunction. GFR glomerular filtration rate provides a detailed estimate of kidney function by calculating the amount of filtered blood. Glomerular filtration rate (GFR) values below 60 ml per minute indicate significant renal or kidney impairment. Urine analysis detects proteinuria, hematuria, or signs of infection, critical for identifying glomerulonephritis or urinary tract infection, or UTI for short. For example, if a patient's GFR is 45 ml per minute, documenting this along with other abnormalities in electrolytes can prompt early nephrology referrals and delay CKD progression, chronic kidney disease progression. Trend monitoring. Renal or kidney conditions are often chronic, making trend documentation vital. Baseline values, knowing the patient's usual creatinine or GFR glomerular filtration rate, helps differentiate acute conditions, for example, acute kidney injury, from long-standing issues, for example, CKD, chronic kidney disease. Rate of decline: a rapidly rising creatinine level may suggest acute trauma or medication-related neurotoxicity. Scribes should ensure serial labs are recorded sequentially to establish patterns and changes over time. Documentation of risk factors and symptoms. Kidney function often reflects systemic processes, so scribes must be vigilant about associated risks and symptoms. Risk factors: diabetes, hypertension, obesity, and exposure to neurotoxic drugs, for example, non-steroidal anti-inflammatory drugs, NSAIDs, or certain antibiotics. Recording these in the patient history flags individuals at risk for renal or kidney impairment. Symptoms of renal disease. Kidney disease symptoms like edema, fatigue, or changes in urination, frequency, volume, or color must be noted carefully. For example, frothy urine can indicate proteinuria, commonly seen in nephrotic syndrome. Actionable documentation. Scribes should facilitate the delivery of actionable information to ensure timely interventions. For example, here we have acute findings. And we have therapeutic changes. Acute findings like recording potassium levels more than 6 MEq over L, alongside documentation of EKG or ECG findings, ensures prompt management of hyperkalemia. Therapy, which is high potassium levels in the blood. Therapeutic changes, if medications need dose adjustments, scribes should capture this and link it to the renal or kidney results. This prevents medication errors, for example, dosing contrast agents without acknowledging GFR data. Special cases, additional attention is required for certain populations or scenarios. For instance, dialysis patients, highlighting prior hemodialysis sessions, and vascular access. For example, arteriovenous fistula ensures continuity of care documentation. Pregnant patients, even subtle changes in renal function can signify preeclampsia or other complications. Summary tables next. We have table on common GI symptoms and their characteristics, table on key components of patient history for GI assessment, table on common diagnostic tests for GI symptoms, table on key renal or kidney function tests and their significance, table on interpretation of renal function test results, and then next we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Now, question 1. What is the primary purpose of documenting the onset and duration of abdominal pain in a patient? A, to determine the patient's pain tolerance, B, to identify potential dietary triggers, C, to differentiate between possible conditions, or D, to assess the patient's emotional state. Definitely C, to differentiate between possible conditions, as documenting the onset and duration of abdominal pain helps healthcare providers or clinicians distinguish between different conditions, such as appendicitis, which typically presents with sudden onset, versus chronic conditions like irritable bowel syndrome. Question 2. Which of the following tests is most commonly used to visualize the lower gastrointestinal tract, lower GI tract? A, endoscopy, B, colonoscopy, C, ultrasound, or D, CT scan? Definitely colonoscopy here. B, as a colonoscopy is specifically designed for visualize the lower GI tract, allowing for the detection of polyps, cancer, and other abnormalities. Question 3. What does an elevated serum creatinine level typically indicate? A, dehydration, B, liver dysfunction, C, impaired kidney function, or D, electrolyte imbalance? Impaired kidney or renal function. C, as elevated serum creatinine levels are often a sign of impaired kidney or renal function, as the kidneys are responsible for filtering creatinine from the blood. Question 4. Why is it important to document the patient's family history of GI disorders? A, to assess the patient's diet, B, to evaluate genetic risk factors, C, to determine the patient's lifestyle, or D, to identify medication side effects. Genetic risk factors. B, as B is the answer, to evaluate genetic risk factors, as documenting a family history of GI disorders helps in assessing genetic risk factors, which can influence the likelihood of the patient developing similar conditions. Question 5. What is the significance of a GFR glomerular filtration rate results below 60 ml over minute over 1.723 meters square? Or m to the power 2. A, normal kidney function, B, acute kidney injury, C, chronic kidney disease, or D, electrolyte imbalance. So definitely we have a kidney problem, and most likely will be C, chronic kidney disease, CKD, chronic kidney disease. After a long term of kidney disease, the GFR will be below 60. Long term, chronic. So as the AGFR below 60 ml per minute per 1.73 meters square hour, m to the power 2, is indicative of chronic kidney disease, chronic renal disease, suggesting reduced kidney filtration capacity over a prolonged long-term period. And here we come to the end of this lecture. Thank you very much and goodbye.